Good afternoon. This is Bryce, and you're listening to GenRX Radio on 90.7 WCLH, Wilkes-Barre, Scranton, Hazleton. Keep it locked.
This is Jamie, and with us this week, we have Dr. Franco back, an associate professor of pharmacy practice here at Wilkes University Nesbitt School of Pharmacy.
I am happy to be back with you guys here. I'm coming from a vacation. Always not happy to be back. Who's happy to be back from vacation? Nobody is, but have to come back. That's what makes vacations special, is they have to end.
Very true. So we will always have a licensed pharmacy faculty member with us on the show to ensure accurate information goes out to you. We are here to bring you weekly topics centered around the opioid crisis, proper medication use, and disposal in our community. Be sure to tune in every Wednesday afternoon from 1 to 1:30 p.m. right here on 90.7 WCLH for new topics and discussions.
So last week, we had Dr. Keek on the show with us to talk about harm reduction strategies. We talked about clean needle programs, naloxone, medications for substance use disorders such as buprenorphine, and just in general, how pharmacists could be a huge resource for someone with substance use disorder. I just wanted to emphasize again how important these things are. Clean needles are one of the number one ways to prevent infections and transmittable diseases in people that use drugs. It is super important for pharmacists, number one, to dispense these needles, and number two, to counsel people who buy them why they are so important. Naloxone is also a life-saving medication, literally. Naloxone reverses an opioid overdose in the case that there is one. Dr. Keek really emphasized how naloxone isn't just for someone who has substance use disorder or is prescribed opioids. She said how it really protects everyone who's around opioids. Accidents happen, and having naloxone on you could be the difference between life and death for someone. And last week, we finished up the show with just emphasizing how pharmacists are a huge resource. Pharmacists are very accessible and free healthcare. If you have substance use disorder, having a conversation with your pharmacist could help you find resources for treatment or help with your addiction.
Those are all great points. I'm happy that Dr. Keek was here to discuss them, and you're spot on. The price of a sterile needle is nothing compared to the cost of treatment of Hep C, or the treatment of HIV. Naloxone, yes, as you said, accidents happen. Majority of people who died from prescription-related overdose deaths, at least in 2018 in Pennsylvania, were those over the age of 75, leading me to think that seniors get confused or they're overprescribed. And all those different harm reduction strategies need to be socially accepted. That's how we get legislative changes to make a lot of those harm reduction things are not legal in Pennsylvania. So getting that social change is part of the battle, but we'll get there, one day at a time.
Yes, we'll hopefully get there. So Bryce, thanks for the good wrap up. This week, we're going to talk about stigma reduction surrounding substance use disorder. I wanted to start off with a statistic. 1 in 14 Americans report experiencing a substance use disorder. That is around 20 million people that are affected in the U.S. alone. For comparison, heart disease is estimated to affect 30 million Americans. These numbers are not all that different, yet we treat those suffering from these diseases very differently. Of course, the medical treatments are very different, but today we want to discuss the way those suffering from substance use disorder are viewed by society.
You brought up an interesting point about how many people have a substance use disorder versus have heart disease. And when we look nationally, we see that there is what's called a treatment gap. So treatment gap just means people who need help that can't get it. There's a 1 in 5 treatment gap nationally for substance use disorder, meaning 1 in 5 people who needs help is able to get it. Now, imagine if we put that with that heart disease. Imagine 1 in 5 people with heart disease who needed to go to a cardiologist could go to see one. There'd be pandemonium. So yeah, the approach to patients with this condition, much like other subjective conditions, is different. That doesn't mean it needs to be feared.
Yeah, that's a really good point, Dr. Franco. And just think about how we might prevent some other diseases like that are associated with substance use disorder, like how if we focus on smoking, we might decrease the rate of lung cancer, or if we focus on alcoholism, how we could decrease the rate of liver diseases.
Well, there's things you have to look at when you brought up liver disease, that there is a social component to this. That's the problem. Substance use disorder is a social condition as well as a health condition because the symptoms are social. You act a certain way, you do things that are considered not good. When we look at alcohol and nicotine for that matter, because nicotine by far and away kills more people than than opioids or alcohol, they are socially accepted. You do, we even had it now. The semester's over for you, right? For you guys. Oh yeah,
Yeah.
here
Oh
it is.
yeah, we're so
There
excited.
is jubilation, right? Trust me, we feel it too. Well, we say the semester's over, and you're like, we're gonna pop the bubbly, as they would say. So alcohol is used as part of celebrations. Alcohol is used for a lot of different things, and it's historically been used for that as well in many cultures. So there's that balance that needs to be walked. Nobody's here advocating we need to go back to prohibition. That was a immensely stupid idea that this country did. What we're saying is that moderation is got to be the key with all of it. And in substance use disorder, those people don't know moderation. People with their brain doesn't understand that. Their brain knows just keep going. And that's where we have to try to mend the gap.
Yeah, those are some really good points, Dr. Franco. And I think one of the common misconceptions of substance use disorder that makes it hard for people to understand is that addiction is a disease and not just a choice. From the outside, it's very hard to understand why people with substance use disorder would choose a chemical over things such as a job, friends, or family. But today we wanted to educate them about why to them it really isn't a choice. Whatever someone is addicted to becomes associated in their brain with things necessary for survival, such as food and water. To them, using a drug is really no different than eating 3 meals a day or drinking 8 glasses of water a day. When they use them, they are really satisfying a survival need in their brain. But there's not one single driving factor that leads to addiction. Some people may use drugs to help cope with stress, trauma, or to help with mental health issues. Some may even develop opioid use disorder after misusing opioids they're prescribed by doctors. And there are even genetic and psychosocial factors. But in any case, using drugs over time makes it easier to become addicted.
So diving deeper into what Bryce said and focusing a little bit more on the science, when people take drugs, the brain is flooded with chemicals that take over the brain's reward system and cause them to repeat behaviors that feel good. Like Dr. Franco said, they really don't know moderation. Over time and continued use, the brain adapts to their continued use by developing a tolerance, which means that it takes more of a drug to feel the same result. This makes it very hard for the person to resist continuing to take the drug so that they can feel that same pleasure that they got from it before. The tolerance affects the brain's reward system as a whole, not just when they take the drug, meaning that other activities such as eating food or even hanging out with friends are not as pleasurable as they were before.
And that's known as anhedonia, fancy word, without pleasure. And when we look at addiction, we see that it is a disease it's a disease focused on the inability to feel pleasure from once pleasurable things. Things that used to make you feel happy no longer do. And when people use drugs, alcohol, gambling, it doesn't matter. It's not because it makes me feel good. Some people come home from a hard day of work and they're like, I'm going to have a beer because it makes me feel good. People with an alcohol problem look at that can of beer and go, if I don't drink that, I'm going to die. And we know it's triggered by stress. That's why people relapse at worst possible times. They relapse before the big job interview, their court date, the custody hearing. Stress tells their brain, or I should say their brain perceives stress at a level that is not controllable. And their brain says, this level of stress is now life and death type stuff. To us, it might seem like, what are you doing? But their brain sees it differently. And when their brain fires like that, their ability to make rational thought, wow, this is a bad idea, I shouldn't do this, is completely shut off. So it doesn't condone the behavior. I'm not saying we should completely forgive and apologize for behavior. I'm saying we need to better understand it. And when we look at it as a disease, we can actually see, much like with diabetes or asthma, where we have a pathology, there's a clear pathology here. It's just difficult to understand because it's subjective and it's social. It's not a disease that we're used to seeing. But again, there's that social change. We're getting better at it.
Yeah, those are some really good points. And just like a story from class, Dr. Franco had us do an addiction project where we gave up something that we use every day. And I ended up giving up coffee. And just after like 2 or 3 days, you could really just see how your body adjusts to that. And one thing Dr. Franco also emphasized in class is just the feeling of guilt of people with substance use disorder. And that feeling of guilt is really what drives the cycle of addiction.
Well, it's not so much guilt plays a part of it. So guilt you feel because of a misdeed towards somebody else. So I feel guilty because I ate the last slice of pizza. Like I feel guilty for that. Addiction is more predicated on shame. And shame is feeling of letting yourself down or letting down somebody. So a misdeed versus a letdown. It's sort of like that, I'm not angry, I'm just disappointed. If you've ever been given that one, which just is awful.
Definitely.
We've all been there. If you've ever been given that, that makes you feel shame. You feel you've brought shame on yourself or on others. And that shame spiral falls into a sense of, does anybody love me? If I can't love me, do other people love me? That builds anxiety, that builds cravings, and then off we go. So yes, it's a disorder of the brain predicated on shame based on the inability to perceive pleasure from once pleasurable things. And when people use, it's not meant to feel euphoric or high or drunk or anything like that. It's to feel normal. They say they feel like that hole in their heart has been filled for the first time. And I think people don't see that. And that's why when you have a medication like buprenorphine, which fills that hole, but doesn't have all the horrible things that come with heroin or alcohol, that's why that drug is so good for so many people. Not for everybody, but for so many people. And I think that's there. And now we're back, social change, getting that more accepted, getting the stigma, because not only is the disease stigmatized, but the treatment is stigmatized.
Yeah, that
Very
was
true.
great points all around. But we're going to take a quick break, and when we come back, we're going to continue to discuss how addiction is a disease and some further ways to reduce stigma. Thank you for listening to GenRx Radio. Keep it locked on 90.7 WCLH until we return.
Welcome back. You are listening to 90.7 WCLH, Wilkes-Barre, Scranton, Hazleton. For those of you just joining us, you are listening to Generation RX Radio. My name is Jamie. With us, we have Dr. Franco, Associate Professor of Pharmacy Practice, and Bryce. Before we move on, let's do a quick recap of the first half of our show.
Man, you're demoting me.
I'm so sorry.
Oh, no, it's all good. It's all good. No, we were talking about how substance use disorder is a disease and why people do what they do when they're in the thralls of their addiction, trying to make it not something we want to condone, but something we want to understand. And it's a whole topic, but we're going to it's like an onion, many layers. We're going to quote Shrek here. You just got to peel it away one layer at a time.
Yeah, I love your point about how we're not condoning it, but we really need to educate because it's so important to try and understand where these people are coming from to help better treat them.
Definitely, and I love the Shrek reference. But we are here to bring you weekly topics centered around the opioid crisis in all of our communities. Be sure to tune in every Wednesday morning from 1 to 1:30 p.m. for a new show. We are representing GenRx, an initiative through the American Pharmacists Association Academy of Student Pharmacists chapter here at Wilkes University. So while we were preparing for this show, we were getting research from the Recovery Research Institute, and I think the best way to reduce stigma is to really just get educated on the topic. And there's really no better way to get educated than to hear how addiction is directly from someone who suffers with it. So here's the story that was online. I am a certified registered nurse anesthetist and had a problem early in life with alcohol. Never thought I would get into a position where I would use anesthetics or see my disease progress to the point it did. I thought I had my using under control. I didn't drink for over 8 years. But life happened and became too overwhelming for me to deal with. I turned to my old ways of dealing by numbing with alcohol and ended up thinking I could handle my life only if. Then it became okay to pick up anesthetics since it was so familiar to me, and I thought I knew so much about the drugs, having given them every day for the last 15 years. I was very wrong. I now know about the disease of addiction, and the only way I have found to stop my obsessive and compulsive thinking is through the spiritual means of working a 12-step program. It has truly changed my life, and in the process has saved my life as well. I am truly grateful. Paula, 45, who is 5.5 years in recovery.
That's one, we're happy to hear that that person has found recovery. It brought up that after 8 years of being in recovery, that a relapse happened, and that's not uncommon. There are people who could be in long-term recovery for decades and that relapse happens. The last 2 years have showed us this. Stress. Look how much stress everybody has been under because of COVID and jobs being lost and all the other things that have happened over the last 2 years. But having the courage to share the story is part of the recovery process. And you brought up 12-step recovery and the spiritual journey that it is. And we'll on future shows, we'll talk about the 12-step program, and we'll talk about what it means to be on a spiritual journey. I know it sounds really like guru-istic. There's a lot to it. It's not like going to a religious service. We're going to talk about that, but it's great to be able to hear that somebody was in recovery, relapsed, and had the humility to find the recovery again. And that's a great step forward.
Mm-hmm. Dr. Franco, you touched on AA a little bit in the spiritual component about it. I know one of the many criticisms is that you have to be religious and that only God could save you is kind of like one of the mainstays of AA. But could you talk about how it really is for anyone and how really it's just more about spirituality than really religiousness?
Oh yeah, there's a big difference between religious and spiritual. You can say that all people who are religious are spiritual. Not all people who are spiritual are religious. It's like that all squares are rectangles, but not all rectangles are squares type deal, to pull some geometry in. So a spiritual person recognizes that there's something in their life beyond themselves, that it's not all about me, and that without other entities, I couldn't make it. Now, those other entities to some are a religious being, a god, as you would describe them. But even in it's called the Big Book, and it's available, you can buy it or whatever you want, the Big Book of Alcoholics Anonymous, there's a section in there that talks for people who are atheist or agnostic. And that's why they say God as you understand him or her. To some people, and they mentioned this at the Utah program, they say God to me is an acronym, GOD, group of drunks. My friends at the AA meeting, they're my spiritual resource. That's who I turn to. And that's great. So it doesn't have to be a religious deity. It can be just something beyond yourself, your friends, nature, whatever. It's turning yourself over to that higher power, which means recognizing that this is something that you need help to do. I need help is the way that you can look at it.
Yeah, I really liked how you talked about it and how you really emphasized how AA really is for anyone, and you could really believe how, like, whatever you want and still get through it and still have a really good experience with it.
So we're going to move on to this week's current event. We wanted to talk about recently published survey results that showed the percentage of adolescents reporting drug use has decreased significantly in 2021. The survey looks at the number of 8th, 10th, and 12th graders who self-report any drug or alcohol use over various time periods. In addition, the respondents reported to an increase in feelings of boredom, anxiety, depression, and other negative mental health indicators since the pandemic began.
When we talk about mental health amongst kids, wow, just the numbers that are out there. And a lot of it is probably attributed, I saw a report on this the other day, a lot of it may be attributed to screen time, social media, Facebook, Twitter, Instagram, and all that as to how we all do it. You put a picture on any of those, or you say something on any of that, and it has to look just right. It has to look perfect, and everything has to be great because you want to look good for everybody. But it's a show. It's a facade. That's all they are. So that hurts. But when we talk about children and adolescents decreasing potential use, that could be big. Now we look at the last 2 years and we could say, well, could there potentially be a decrease in that group? Well, everything's virtual. You're not doing anything in school. There's no partying. There's none of that. You're stuck at home. Will that continue? I don't know. I really don't know. I don't think anybody does know, nor should we know, what would happen when those kids, especially those older kids, go to college or whatever their post-high school career, wherever it takes them. Tough to say what'll happen. More access happens at that point. We'll just hope that it continues in that direction. And if they found the special sauce, man, let's have them come on the show, yeah. But come and talk about what they found as a way to try to better manage that stress.
Yeah, that special sauce you were talking about, they're still trying to look through the results and see maybe if they could find some of those factors that did lead to the decrease. They haven't figured out any in particular that was noted in the study, but they want to find some and make sure that if there are any, that they're going to use those into programs to help keep these numbers low.
Yeah, great points. But we're going to start wrapping it up for this week. So, Dr. Franco, could you just give us some take-home points?
Just remember that addiction is a disease. We're not trying to condone. We're trying to understand. If you're somebody out there who has an addiction, remember that it's not you. It's the condition that's controlling it, and you can overcome it. And if you're somebody who has a loved one with an addiction, know that there are treatment options available to you, and that learning how to better understand and continue to show that love, but not let that disease overtake you, is part of your treatment. So keeping that in mind, we'll have plenty more discussions on that as we go forward.
Yep, and with that, we're going to wrap up. Thank you for tuning into our last show for the semester. We are taking a break over the holidays, and we will return with the same great content in the spring semester. Our next show will be Wednesday, January 19th from 1 to 1:30 p.m. Thank you for listening to Generation RX Radio with Jamie, Bryce, and Dr. Franco, and we can't wait to be back with you in the spring. Keep it locked right here on 90.7 WCLH.